Several families tell us that they were blindsided to find out their loved ones were being moved from a Huntersville nursing home. Huntersville Oaks, which is run by Atrium Health, has plans to start relocating some of its patients to other homes in the area. Atrium says their plan is meant to house COVID-19 patients under one roof in Huntersville, where they have some of the best equipment in the state. Well, still, families say that they were not notified in time. They're also concerned with the physical and emotional toll that this can have on their loved ones.
Alzheimer's patients have been proven with dementia that they cannot handle change very well. This could put my mother into a tailspin.
The moving process is expected to start tomorrow. The number of COVID-19 cases across North Carolina still going up, and in the last 45 minutes, the state confirmed 10 new deaths and nearly 200 new cases. There are more than 8,800 cases now confirmed with 299 deaths. Mecklenburg County is at 1,400, a little over 1,400 cases. That's 31 new cases since Friday afternoon and 41 deaths total so far. And in Mecklenburg County, we'll likely see more perspective on those details tomorrow when the health department has an update. In South Carolina, still waiting for the latest numbers, but as of right now, 5,200 cases and 166 deaths. That's an increase of 180 new cases and 9 deaths.
When it comes to the virus, people with medical experience have been helping however they can. And
actually jumping in and helping can be difficult in a number of ways. As you can imagine, if someone knows you're around infected individuals, that might make them nervous. Channel 9's Aaron Edwards heard from a woman helping during the outbreak who was put out of her hotel because of it.
It feels terrible.
Tony Thomas came from Eastern North Carolina to help at a nursing home in Salisbury that's short-staffed. Her company management arranged a room for her at Home 2 Suites by Hilton. On Wednesday, Thomas says she made small talk with a hotel employee who asked why she was staying here.
I'm a traveling medical corps and I'm here to help out, and she asked if I had any patients on caseload that are COVID-19 positive, and I said, well, I can't talk about really the building that I'm in or anything like that, but yes, we do have those clients.
The next day, Thomas says staff would not enter her room.
They left bath towels for me out on the hallway floor.
Then Friday night after work, she found her room key was deactivated. She says the front desk told her she had to leave that night.
All I wanted to do when I came home last night was eat my hot meal that I brought home, take a shower, and get into my room, and I was blocked out of my room. It's so cruel.
But in a statement to Channel 9, hotel management said after learning she was in contact with people who tested positive, out of abundance of caution, it, quote, saw a way forward that was both hospitable and reduced risk for our team members and other hotel guests. On Friday, we shared with Ms. Thomas that we had arranged alternative accommodations at no cost to her or her company. But Thomas says she was never told about alternative accommodations until she got an email at 4:30 this morning with a new hotel confirmation.
I'm here from the other side of the state to help this community, and it feels like I'm being stabbed in the back.
And the hotel told Channel 9 that it wasn't their intention and they did not want to make this any more difficult for someone who's trying to help, and that they hope she stays healthy. They did eventually give her a refund, and as you heard Aaron say there, as of 10:30 yesterday, they gave her another place to stay close by.